Hi, my name is Dr.Laurie Zelinger, board-certified psychologist and registered play therapist supervisor. I'm finding that the children in the school where I work are wondering about Ebola, and the parents in my private practice are asking, what do I tell my kids? So my son Jordan and I decided to make a video that would explain Ebola to children in a way that was simple, accurate, and yet reassuring. We synthesized the information in the media and we created a video that's developmentally appropriate for children between the ages of 6 and 10. We filmed it in my playroom, which is friendly, informal, and inviting, and we hope that it would let your child feel like they were there with me. It's our hope that you find this video to be helpful and engaging. Thank you for watching. Hi boys and girls, I'm Dr. Laurie. I'm a feelings doctor, and I'm making this video with my son Jordan. He's a feelings doctor too. The reason we decided to make the video is because we know that a lot of kids are confused about this thing called Ebola. It's all over the news and your parents are probably talking about it. And we figured that if you knew more about it and you understood it, it would be less scary. So we're going to take you on a little bit of a trip to explain what Ebola is. Here's a globe. Here's the United States. That's where we live. Here's West Africa. That's where most of the cases of Ebola are from. Look how far away it is. Imagine that this whole box of sand was people in the world. Like every single piece of sand, every grain of sand was a different person. If all of these people are people in the world, the amount of people that have Ebola would be just this much compared to everything else. But the problem with Ebola is that the people were getting sick, and a lot of people there don't live the same way we do, where the medicine is available and they have enough water. And a lot of people didn't know when they were getting sick, so they got sick without getting any help. And they didn't have as many doctors as they needed. So some doctors who were so brave and had such big hearts said, I'm going to go and I'm going to help. Like him. I'm a doctor and I want to help people because they need more doctors and they need more nurses there and they need more people who can work in laboratories. And he got on an airplane and he took his bag of medicine and everything else he needed, and he flew for a long, long, long time until he got to West Africa. And he had something for him to wear so that he could stay protected because he didn't want to get Ebola. So he would wear special clothes and he would wear special masks. But it's still me under here. And he'd also put on special gloves. He dumped out all of his medicine and started to give out all the medicine that he needed. Sometimes they were able to help people, but sometimes they weren't. The people, when they got there, the people were too sick, and then they died. And everybody felt terrible about that. And they wanted to figure out, how can they stop Ebola? And they learned that they have to keep sick people away from well people. That's called quarantine. You really can't catch Ebola just by being near somebody. You have to be so close to them that you could hug them or kiss them, or that you'll touch the things that they licked, or if they pooped, you touch their poop by accident. But it has to be you have to get so close to something about them. And now all the doctors in all the hospitals are learning about Ebola, and they're learning how to help people who get sick. They're also teaching us that we can't get it just by being near somebody. You have to be touching somebody who has it. And remember, we don't touch strangers, and we always stay about this far away from people if we don't want to get sick. And since hardly anybody has it, hardly anybody will get it.